Welcome to Bite Size Dental Marketing. Today I have Chad. Chad, thank you so much for taking the time to meet with me. I loved chatting with you on the pre-show, and obviously we've met earlier a couple of months ago. But Awaken to Sleep, I love that you are now coaching practices in implementing sleep appliances, and that is such a growing trend and growing in popularity. And of course, as the appliances get better, so does the outcomes. And many of our offices are trying to roll it out there. And I love how you guys have created this niche space of coaching around implementing it. But before I jump in, I would love to hear about where have you been all my life? How'd you get hooked up to Awaken to Sleep? Tell me a little about your origin story.
Yeah, the short version is for me, I was in education. I was in financial sector. I had two businesses running simultaneously. The education company running for about 10 years, the financial company running for 5 years. And there was a time in my life where California launched some new laws that made it really difficult to do business out here. So I ended up shutting one of those companies down because it just became too expensive. And then the other company, it was time to transition out of that. And so I was just kind of looking around, working in consulting for other businesses. And I met Michael Cohen, the CEO of Awaken to Sleep. And this was about 6 years ago. And with that, he had just launched this company that a couple of years prior that did sleep testing. But in talking to him, I discovered that he had a passion for teaching, for coaching, for equipping the dentists in the country to really make a difference in their patients' lives. And while he did a lot of that through the vein of testing, because this process all starts with getting a home sleep test, it would often go well beyond that into topics like handling objections, screening, appliance selection, really any of these different myriads of pathways that we can take into the treatments that is oral appliance therapy. And we were working together for a couple of months, and he said, you know what, Chad, I need you here full time. I need you to come on the team. I need your help to do what we're going to be doing. And 6 years ago, we launched our online academy called Sleep Hero Network. We launched our first coaching program, which had a very funny theme to it, but it was a digital implementation coaching program. And fast forward about 4 years, we decided to make the transition. We closed down the sleep testing business entirely, and we've completely transitioned to the coaching and education and training module around dental sleep medicine. We don't coach anything other than dental sleep medicine for practices that are either just getting started all the way to practices that are ready to go to sleep only or make that big pivot to being a sleep only provider. And for me, like I said, it was kind of a lucky coincidence. We knew some mutual people, started consulting for them, and the rest is history.
That's so great. That's a wonderful story. Through those last 4 years that you've made this transition to coaching only, what have you seen in the industry? I mean, it's easy to say, it's growing, but what are you seeing out there as the opportunities and challenges that practices face?
Well, one of the opportunities is that practices have right in front of them is that right now our data shows that between 30 and 35% of your existing patients in your restorative practice have an airway concern. If you screen patients for 2 or more indicators, that could be bruxism, that could be high blood pressure, that could be daytime fatigue, any of these things, and there's a list of probably about 20 or 30 different signs or symptoms we could go through, that you're going to find 30 to 40%, 30 to 35% of your patients need a home sleep test to evaluate their airway. And then of that, 70% of them are within a range that dentists can treat with an appliance first before CPAP. And that's the opportunity that's there right now. If you've got a practice that has 2,500 patients in it, you have between 500 and 600 patients that should be in an appliance or likely need an appliance right now. It's going to take you a couple of years to get through that list. That doesn't include new patients. That doesn't include marketing. That just includes what's right now available in your practice. And so for practices that aren't doing this, there's so many people that need your help. And I mean, on the business owner side, there's a lot of money to be made. And it's just a win-win for everyone. On the obstacle side, you mentioned obstacles. I would say the most common obstacle we see in dental sleep medicine is that practices will often try to implement medical billing and this new procedure in their practice at the same time.
That's the dream. Yeah, that's what we hear the most. Yeah.
Absolutely. But I can tell you, I'm not exactly in the best shape of my life, but if I wanted to run a marathon, I wouldn't start by practicing a marathon. I would start by running a mile,
Mhm,
which it's
mhm,
been
mhm,
God knows how many years since I've run 1 mile. Then I would run 2 miles, and then I would
mhm,
run
mhm.
3 miles. The same thing, we have to do the same thing with dental sleep medicine. You don't go to the gym and start lifting 300 pounds because that's what you want to be when you grow up. You have to start somewhere, start with
Mhm,
the
mhm,
fundamentals. And medical billing is an amazing tool. Medical billing opens the doors for more patients, makes the treatment more affordable. It even opens up the door for physician referrals. But until you've got protocols, systems, and your team on board, it doesn't matter. And
mhm.
medical billing will kill a practice if the fundamental components are not established first. So that's the number one obstacle we see there.
And what are those fundamental components you mentioned? Like how do I go from, I the dream dentist, right? I want to work fewer days. I want to make more money. I want to drop insurance. I want to do sleep medicine. The if I can do that, I'm gold.
Right.
But how do I go from I have this ambition to roll out sleep to actually making my first, patient consult and getting into the 50, 60, 70s, or I don't know, 10 a month maybe. How do I get there?
Yeah. I mean, the first thing is testing your team. Uh, there is you asked about my origin story, back when I started Awaken to Sleep, a young single guy who was a buck 45 soaking wet. And I didn't think I had sleep apnea because no one thought I had
Mm-hmm.
sleep apnea. I became a tremendous advocate for sleep apnea because Awaken to Sleep required that I test because every staff member here has to test. I became diagnosed with moderate sleep apnea, got an appliance before I did surgery and CPAP, and ultimately found out that my life was infinitely better because I got better
Mm-hmm.
sleep. Because I stopped choking 20 to 23 times an hour on my sleep every night. It makes a big difference on your life. So, first thing is get your team tested, even if you got to pay for it. The second thing is get your team trained. Well, you can't do sleep by yourself. That's not true. You can do sleep by yourself, but you'll probably wish you had just stayed in restored dentistry. Sleep is a team driven protocol. And if you want to work less, make more money, and help more people, then you got to bring your team along. And then
Mm-hmm.
from a workflow standpoint, you just got to have a very clear protocol on one, how do you screen people? When people are screened, patients are screened, how do you get them to a home sleep test? Once they're tested, how you treatment plan them. And then once you treatment plan them and say yes to treatments, what do you do with the appliance and the follow-up protocol? There's four pillars we'll have to go through. The protocol doesn't have to be hard. We can teach it literally in one day. We have 7-hour
Mm-hmm.
courses that we do, and most practices are really amped and equipped to go forward and actually do them.
Mm-hmm.
But again, if you try it without your team, it doesn't matter.
Yeah. Now, you mentioned the four pillars. Walk me through the four pillars, and how do you layer them in like an ideal engagement for you? So, okay, I want to do it. Do I come out and take a class? What's an engagement look like for you?
Yeah. We work with practices in really any capacity. We have the opportunity for practices to do what we call a 1-day interview and a CE course at the same time, 1 day virtually on Fridays, typically during most months of the year. This is an opportunity for you to bring your team virtually, learn the basics. Our course follows the protocol, the four pillars, to a T. We're going to tell you what sleep apnea is, how it impacts your patients, and then walk you through the entire process. But beyond the workflow, we're going to give you verbiage, forms, resources that you need so that whether you work with us or not, it doesn't matter. You're going to go out there and know enough to go help some people.
Mm-hmm.
So that's our objective in serving our community. But if you want to work with us, you can hire us to come out and do a private training for your practice. We do offer that, but we've made it accessible and affordable. And really, we make it affordable. If you go to our website, you'll see that we just want people to come, and we've brought it the cost as low as we possibly could to make sure that dentists and their teams can come and do this course. If you decide after training with us, whether it be in person or virtual, that you actually think we're fun to work with, that you like our style, that you like our message, at that point, we may invite you to be a coaching client with us, where we have a usually 6-month engagement of working in your practice using metrics, working with your team on coaching calls every month, where we're working on those business units. We're seeing what things your practice needs, and then working on that specific strategic objective with your team, and then meeting with your leadership and using qualitative and quantitative metrics to determine objectively what's going on in your practice. And combining with leadership meetings, metrics, and what we can see in your team, we can actually work on your business and grow your sleep practice.
So not only from just the how you roll out sleep, but how it applies to your P&L, the true leadership and business side of implementing sleep. Is that the pivot mastermind that is on the side? Is that what that is? Is once
Yeah.
you've rolled out sleep? Go ahead.
Yeah, so the pivot, that's a great question. So one, all coaching includes metrics. All coaching includes that objective review and yes, the leadership component, because frankly, it's business. We're building a business here, whether it's a business unit in your restorative practice or not. So we are going to be doing that leadership training. We're going to be doing that, looking at the P&L, looking at the money you spent on appliances and people and softwares, and we do that. That's standard. But for those that are ready to pivot their careers, so play on words there, and we are not ashamed of it, okay? It's a fun one. Those who are ready to pivot in their careers, they're ready to take sleep to be independent. We've had several practices that we've helped navigate selling their restorative practice and going sleep only. We've had practices that are launching a sleep practice while running several restorative practices. Typically, pivot members are ready to launch a sleep practice. It doesn't have to be the only thing you're doing, but it's a significant pivot in their career. And in that's an invite only program. We actually you can't just buy your way into the program. You have to actually meet our team, make sure that you're a good fit. Because in this group, you're going to be working on your business with your other pivot members. We have dentists in the group who we meet monthly. Their teams meet monthly. They are working together on their businesses, learning together. We bring experts in from all over the industry, from the medical and dental sleep medicine spaces, to teach on very unique topics. And we do things like live training, units. It's a 2-year program where you're going to build the business of your dreams and really make that pivot in your career. And so I would say, check out the website on that. There's a lot of information. See if you're ready for it. I would say before you can pivot, you've got to work with us for a couple months just to make sure that we're a good fit. We would never force someone into an agreement that wasn't a good match, because that's just not good business.
No. Once you begin to roll out sleep, what are the KPIs you like to see? Is it 5 per month? How do you start measuring success as I'm growing along this sleep appliance journey?
Yeah, great question. First, we actually got to look at how many people your team is talking to. This can be done with custom codes, our custom metrics. But if your team isn't talking to people, well, then you're not going to get any progress, right? So that's one of our first KPIs we've got to look at, is how many people or what percentage of our patients are being screened. On average, following one of our courses, most practices, without any additional coaching, can screen between 60 and 70% of their active hygiene patients with some introductory screening training. Really, our goal is to get you to 80, 85% on average. That's not that challenging to do, but accountability helps. The second metric is, once we say someone is at risk, which I said 30 to 35%, depending on where you're located in the country, will be, how many patients say yes to a test? It doesn't matter if you have your own equipment or if you're using a company like sleeptest.com, but how many people say yes to a test and then actually, do the test? Okay. That's a very important metric. We cannot grow a sleep practice unless we have patients who are diagnosed with sleep apnea. And so we've got to find out how many people there are. From there, we track, which is kind of a bonus metric, how many people you test come back as snoring, mild, moderate, severe, or central. So we understand who is our first at bats, right? Our mild to moderate patients, per the American Academy of Sleep Medicine, can be treated with an appliance before CPAP, right? So long as the physician recommends that path, we can move forward. The second thing is those CPAP intolerant, which accounts for roughly 20%, severe patients account for 20% of our average diagnostics. Those patients can actually come back for an appliance if they fail CPAP, which 70% do. So lots of stats there. But the point is that we've got tons of people that need help. We're going to track how well we're getting those people who get tested to say yes to an appliance. One of the biggest metrics that we have to work on in practices is sleep case acceptance for sleep cases. It is a unique thing. We are now selling what looks something like a mouth guard sometimes. And we're selling that upwards of $2,500, usually between $2,800 and $4,500 for this appliance. It's an expensive mouth guard if you don't know how to sell it. Now, this is therapy, not a mouth guard. So that includes your consultation, that includes some follow-up testing, that includes the adjustments to the appliance, which you would have done anyways, okay? And we're going to build value in this. We teach practices on how to do that. There's a process of reviewing their home sleep test that we'll work on. And we're trying to get that case acceptance up to your normal case acceptance in your dental practice, maybe even above. Ideally, fee for service at first, long-term, maybe incorporating some medical billing. And then the last one is we're looking to evaluate how effective our therapy is on average for patients, because that's going to help us build those physician referrals. If we can say we've got X, Y, and Z case study, patients started at this score, we got them down to this score, and this is what it looked like, that's going to help us grow our business in the long term. So I gave you a bunch there. Is there anything you want me to dive a little bit more specifically into?
When you first roll out sleep, you're not pushing the medical billing component of it. What are your markers to indicate that when that is time?
Yeah.
Because I do hear all the time, like I almost hear most practices, they almost try to flip it. They try to get medical billing first.
Yes.
So they can't sell it. But what are the markers you like to see before you roll out medical billing?
Yeah, there's a couple. As you mentioned this earlier, and I kind of skipped over it, I apologize, but we want to see practices fee for service performing 3 to 5 cases a month. And I'll be honest, Eric, there are a lot of practices out there. They find their groove, 3 to 5 appliances per month, and they don't want to do medical billing. They're going to treat sleep like Invisalign for the rest of their restorative days. Because it's fee for service. Medical insurance may or may not cover it. Doesn't really matter. It's a life-saving treatment. And if you want to do something else, go ahead. We're going to make $10,000 or $15,000 a month and have this really fun little service on the side.
And how much chair time do you think those 3 to 5 a month take?
Well, it depends.
Yeah.
If you follow our advice, the doctor's chair time should be less than 30 minutes on average.
Wow. So high yield though.
It should be more profitable than implants.
Yes.
A single unit implant. If you're a doctor who, shall we say, has a bit of an issue letting your assistants do things for you, you could be looking at an hour and a half. But listen, that's your own. You got to figure that part out. We're here to help if you want. But I've got good friends that are like, I'm having a hard time letting this go. I'm like, well, then you can keep doing an hour and a half chair time. I don't know what to tell you, and that's okay. They're still making good money. It's the same thing with implants. But looking at the medical billing question you just asked, there's a couple indicators that we can look at. And one could be enough to move us over the line, but sometimes we want to look at all three. One is we have the volume to justify that we are ready to kind of take our business to the next level. We're gaining serious traction in our practice. The second is that the practice identified that they want to do a more serious sleep program.
Okay.
That's got to be part of our goals. Because again, if you're that first practice, it doesn't matter. And then the third is that we have physician referrals or physicians who want to refer to us contingently upon medical billing. Now, there's one that's kind of the opposite, and this happens very seldomly, but it is worth saying, is that the practices that live in areas that cannot get anyone to say yes without medical billing, that is technically an option that we have coach practices on. I will say 9 out of 10 times, it's because we need to fix the treatment planning conversation first and then add in medical billing. If the practice is unwilling to or unable to fix that part, then we can incorporate medical billing. There's some challenges that just come with that. And that could be a contingent. So there are 3 factors you're ready to level up, you're looking for physician referrals, and you're ready to kind of take your business to that next level.
When you mention the physician referrals, it triggers the marketer in me that's the dream. Right?
Yes.
I mean, I can't tell you how many trifolds we've created, how are you advising these dentists to become integrated in the medical side and build the relationships to get the referrals?
Well, first up is we do have a program. We have an MD marketing kit, right? So that's something that we do. And we actually will curate the list of the physicians in your area that you should be reaching out to on a kind of a tiered basis, priority 1, priority 2, that kind of thing. The other piece is that the medical community just doesn't know about sleep. Most physicians receive between 4 and 8 hours of education on sleep and sleep apnea. 4 to 8 hours. You guys know, listening to this, what your doctor degree look like. You probably don't even remember those little 4 to 8 hour courses a lot of the time. And that's the battle we're facing with the medical community a lot of the time. So what we've got to do is educate them. We've got to share with them. We've got to reach out to them and let them know that we're available, that we do these things, and that we are going to help their patients who are out there. Now, a couple of approaches that you can do to this. One is that there's a gigantic problem. People hate CPAP. I just said this earlier. 70% of people fail CPAP after 90 days. You can Google it. It's not a secret. Everyone knows that. So what if physicians do when patients can't tolerate CPAP? Well, they send them off for surgery. And that's much, much, much more invasive. So we can always reach out to physicians, let them know that there's an alternative to surgery after CPAP in the event that they have patients who are just not complying with CPAP but really need help. I would recommend that you use the data from studies and
Yeah.
research that we've acquired it, but you can find it on the internet as well, that shows that this is effective in treating the disease. And just let them know that you'd be happy to entertain a conversation. Now, obviously, we go into much more detailed coaching on strategies for that, reaching out, stuff like that. One of which is you already have patients who likely have physicians. So if you're treating a patient, let their physician know that you're doing this treatment. Again, being prepared for those conversations can help a lot, but just letting people know that you're around and doing this service is going to be helpful. Frankly, some of the best sales advice I've ever received or even actually given is if you want to get people to send you business, pick up the phone, call them, and then ask them to give you money. In this example, ask them to give you patience. You might get a no, but at least they know that you're around and doing the thing.
Yeah.
So
Listen up. And I would imagine that you have some local doctor on your patient of records.
yes, I'd say 8 out of 10 times for sure.
Mm-hmm.
There are pretty alarming metrics about people going to their doctors under the age of 50. So, maybe they don't know who they are, but you can get that information. You can send over those faxes, especially if you're offering medical insurance. That is an amazing door opener conversation. Physicians usually, not always, usually care about the medical insurance piece. And so as you're growing your business, as you're getting these successful case studies of patients you've treated, that's an amazing door opening conversation. There's strategies such as leaving referral pads over at practices, tapping into your existing patients, talking to your physicians, lunch and learns. You could even test a provider for free or make them an appliance for free if they're already diagnosed. Those types of things, again, just like if you get your own appliance, you're going to be a much bigger believer. So will your physician friends. So just get out there, share and ask.
I love that you push them to test the staff. One of the most frustrating things that we encounter in marketing is it's easier if I can demonstrate excellence to sell the second or the third or the fourth time. It's really hard to sell that first implant or that first big case to basically a rando. If I can practice, if I can get the staff on board, and then use that as marketing material, be like, I've done this, and it just makes it selling it to the general population so much more graceful, and it becomes easier because you have this body of work.
Yes.
And even though it's internal, it's still practice and repetition, and it puts you through steps. But I love that you guys have focused and niched down into this coaching model, because in the challenges today that all dentists are facing of lowering insurance reimbursements, increased competition in the space, and no one's in love with their insurance company, medical or otherwise. This is such a nice additive procedures to roll out, because most of our offices today are either just happy being dentists, and which is fine, or they're moving into sleep, or they're moving into the med spa. And the challenge on the med spa side is, your profit margins are lower because of the cost of your goods sold in med spa. I think sleep just aligns so much more gracefully to the dental space, and I love that you're out there in their corner, Chad. So thanks for doing it.
Well, and on that, with the med spa piece, one of your best referral centers are these performance centers, where men a lot of times will go in to get evaluated. Sleep is one of the metrics. And the reality is that sleep testing and that kind of holistic health is going to be a differentiator for your practice. Less than 10% of dentists, I believe, right now are actively treating sleep. I don't believe less than 10% have learned about it. I believe that less than 10% are actively still doing it. So you've got a lot of opportunity out there. On that, I will say one of our, we call this a fast start protocol. Talk to your team. Sure, they may or may not be resistant. Ask them in their live who is snoring or who is tired or who needs the sleep test. And I guarantee you, if you can get a couple friends or family from a couple of your staff members, give them a couple discounts. Who cares? It's called the cost of learning. Go help them with the test. Go help them with an appliance. Go get 5 to 10 cases under your belt. It'll transform your practice, because whether it's your staff, their family, or their friend, they're all personally connected. Your staff now believes you've got great case studies and you're comfortable with it. And now you're ready to rock. And so And if you're doing a med spa thing, you should absolutely be incorporating sleep, because nothing is better for your health, your face, your aging, things like that, than getting a good night's sleep. And
That's
you
right.
can make this device, this very comfortable alternative to surgeries or CPAPs, that can boost their performance and make them feel better. And it's only the very cheap cost of $3,500, which you conveniently offer financing for, to make it as low as $150 a month.
Chad, so well said. I think that's a great place to wrap it up. I mean, gosh. So this is Chad Wooters, and you know, he's out there helping the world with awakening sleep, and go check out the website. I'll link it in the show notes, and there's a nice contact us form. You can chat with them and give them a shout. If you're gonna roll out sleep, this is the way.
Awesome. Thank you. If you guys need a free coaching call, go to the website, check it out. Awaken, the number 2 sleep.com. Thank you so much for having me on, Eric, today. This is a lot of fun.
Yeah, thank you, Chad.